Hello. If you are like most people in the healthcare field, you chose to work in healthcare because you want to help people in need. At Better Health in Northeast New York, we want to help people too. People like you who want to serve your clients in the most effective and satisfying ways possible. And people like your clients, some of whom may need more help than others. Better Health for Northeast New York, or Bhnny, is a nonprofit affiliate of Albany Medical Center and is leading efforts across a 5-county region to implement Dsrip, a New York statewide initiative to improve the health and lives of our most vulnerable community members. Dsrip stands for Delivery System Reform Incentive Payment Program. In other words, program funding has been made available to encourage healthcare providers across New York State to improve the delivery of healthcare, beginning with the Medicaid population. The Medicaid population consists of eligible low-income individuals that may include the elderly, children, and people with disabilities. Dsrip is focused on this population because Medicaid beneficiaries often incur more health spending and utilize more health services, yet they also experience worse health outcomes than their peers. By creating an integrated, community-based approach to care, individuals can access services that allow them to better manage their health in the primary care setting, at home, or in the community, instead of in the hospital or the emergency department. Avoidable hospital use is expensive and often isn't the best place for individuals to receive the care they need. Bhnny is transforming the regional healthcare delivery system by integrating healthcare and community resources to achieve Dsrip's main goal of reducing avoidable hospital use by 25% over its 5-year duration. Dsrip is about creating a more efficient and effective healthcare system, not about cutting services for patients. Its goals align with the Institute for Healthcare Improvement's triple aim, which is equally focused on enhancing patients' experience and outcomes, improving key population health measures, and minimizing the system-wide cost of care. Bhnny is one of the 25 regional district performing provider systems, or PPSs, across the state. The Bhnny PPS network is made up of behavioral health and substance abuse providers, clinics, community-based organizations, hospitals, primary care and specialty physicians, health homes, and care management agencies, pharmacies, and skilled nursing facilities. Bhnny also works with local government, education, and social service agencies, along with community members to design, implement, and evaluate system transformation initiatives. Bhnny leads Dsrip efforts across a 5-county region, which includes a current assigned patient population of approximately 70,000 individuals on average. This network is the foundation for an integrated delivery system, or an IDS. An IDS is the systematic collaboration of various provider types to create an efficient and effective system of care to address the comprehensive health and social needs of a given population. This is called population health. Bhnny has aligned its 2019 objectives with the Dsrip core concepts of patient-centered care, which ensures that patients' preferences, needs, and values, including their cultural needs, guide all clinical decisions. Care coordination and care management, which provides systematic practices and organization across providers to assist and engage patients with their care. Clinical integration, which coordinates care across the continuum through people, processes, and technology. Value-based payment, which pays providers for value in patient outcomes, rather than volume or more services. And collaboration among multiple provider types, social services, and other sectors, consumers, and the regional workforce. These interrelated core concepts and programming objectives are transforming the delivery of care in our region and are paving the way for an integrated delivery system based on population health management practices. Population health refers to the health outcomes of any group of individuals, including the distribution of these outcomes within the group. We'll look more closely at that in a moment. Population health management is an approach to healthcare that uses data about individuals and groups to drive action and evaluate interventions to improve health outcomes. So what does this mean? Studies show that certain socioeconomic, racial, and ethnic groups incur more spending, utilize more resources, live on higher burdens of chronic disease, and experience drastically different outcomes than their peers. These are called health disparities. By identifying these groups and the disproportionately poor outcomes they experience, We can put resources and strategies in place to work towards health equity. Equality ensures everyone has the same resources available to them, but not all resources are appropriate for all individuals. Equity provides the tools needed by the individual or group that support them having the same likelihood of achieving a positive result. Any defined group can be addressed through population health management strategies. Data, which are facts and statistics collected together for reference or analysis, is another key to population health. By using a process called data stratification, which sorts a large group into smaller subgroups, we can more accurately identify problems in the population and individuals they are affecting most. Data are also used to evaluate the effectiveness of health interventions. In this example, we see the number of new cancer cases and deaths each year for the entire American population. The blue and red bars in the chart make it easy to see the differences in these numbers between males and females. We then see the data for both males and females broken down by race and ethnicity. This level of specificity allows for programs to be designed to meet the needs of each specific group, supporting health equity. Population health relies on complete, accurate, and timely data entry to effectively manage individuals and groups. Nearly all members of the PPS network's workforce play an integral role in regional healthcare through their unique role in data collection. Demographic data are socioeconomic characteristics of an individual or population. Demographics aren't limited to, but include race, ethnicity, and language, or real data, along with age, sex, and others, which allow for data stratification of the larger population. Adding to traditional demographic information, many organizations are now screening for the social determinants of health, which are factors outside of medical care that contribute to an individual or group's ability to achieve good health. We will look more closely at these shortly. Clinical data is essential to understanding the clinical outcomes of individuals, as well as to guide strategies for clinical improvement for a larger population. Electronic health records provide data to population health professionals that offers direct insight into clinical findings. Claims are mechanisms used by providers to bill insurance companies for services provided and include patient demographics, diagnosis codes, dates of specific care, and cost parameters. Claims data can be used to analyze health outcomes and the cost of care. These data sets will contribute to effective program development and monitoring that will be used to measure provider performance and, in part, determine their reimbursement. Healthcare providers are currently paid through a fee-for-service reimbursement system. This means they bill for and are paid for by individual services provided. This encourages them to provide a higher volume of services only. Under population health, providers will be paid instead based on value of the services they are providing through a reimbursement system called value-based payment, or VBP. In fact, the shift to value-based payment has the potential to effectively drive and sustain the shift to population health. VBP contracts set forth specific performance expectations for patient outcomes and healthcare costs. They are intended to make providers and provider systems more accountable for an identified patient population across the continuum of care. This encourages providers to deliver the right service at the right time in the right place, and by the right person. Studies show that medical care alone determines only about 20% of a person's ability to achieve and maintain optimal health. The other 80% of factors contributing to health, all of which are called social determinants of health, include economic stability, education, community, family and social contacts, and neighborhood and environment. Certainly, the health system alone cannot address these factors. Through value-based payment contracts, healthcare providers will collaborate with community-based organizations and other social service agencies to address the social determinants of health through both strategic, targeted interventions and the delivery of non-medical services to satisfy unmet social determinants of health needs. Population health requires an extension of the traditional care team model, which often involves only the core team of the patient and their family and the primary care provider and their staff. Some patients may require the support of additional care team members, such as social workers, pharmacists, peer supports, and care coordinators. These care team members may be internal to the provider practice, or they may be employed by an outside organization. This makes interdisciplinary teamwork and communication essential to providing value-based care. Now that you know what population health is, it is important for you to understand why New York State chose to pursue Dsrip and a path to value-based payment in population health and why this should matter to you. Healthcare spending in the United States continues to rise for many reasons, including a growing and aging population, an increasing number of people with chronic disease, the volume-driven fee-for-service reimbursement model, a fragmented system of various provider types who do not communicate, and higher premiums and out-of-pocket costs. Compared to other developed nations, the United States spends a significant amount more on healthcare per capita, and yet we have the lowest life expectancy and cover fewer residents under public spending than any other nation. Through Dsrip, Bhnny has begun to tackle some of the important barriers to achieving the triple aim of better health outcomes, increased patient satisfaction, and lower overall costs. This image illustrates how Bhnny has integrated stakeholders across sectors to support its boots-on-the-ground, community-based care management program, Bhnny Cares. Launched in August of 2017, the Bhnny Cares team is staffed by registered nurses, care coordinators, social workers, and a pharmacist, creating a truly dynamic, multidisciplinary team approach to assisting patients with facilitating and coordinating access to primary care, mental health, and chemical dependency treatment services. Bhnny Cares also provides support for medication adherence and chronic disease self-management, and they collaborate with health homes and community agencies to address patients' relevant social determinants of health needs. Individuals may also be referred to one of Bhnny's other programs that support coordinated care, such as the Medical Respite Program. This program provides care management and care coordination for homeless individuals during their transition of care from inpatient or emergency department setting to a temporary, supportive setting with continuation of medical treatment. With the goal of establishing permanent housing for the individual, the program prevents avoidable hospital readmissions and emergency room visits. Many individuals have also used our circulation program, a non-medical transportation program designed to bridge the gaps in care caused by inadequate transportation services. While New York State Medicaid does offer medical transportation to its Medicaid beneficiaries, this service covers transportation to scheduled medical care appointments only. Circulation offers qualified individuals non-medical transportation for services that support the individual's social determinants of health needs, including housing, food security, pharmacy, benefit navigations, and others. Authorized users within the Bhnny network approve and schedule clients on demand using a network of contracted vendors, including Uber and Lyft. Community health workers, or CHWs, offer a different set of skills, a different and often more trusted relationship, and the advantage of working in an individual's home to extend the reach of the traditional care team. Bhnny has found success in supporting Albany County Department of Health's Chronic Disease Community Health Worker Program, a prime example of care team extension to support population health. The program allows the county's community health workers to work in collaboration with the clinical expertise of the Bhnny Cares team to provide services needed by patients to address social determinants of health not traditionally provided in the medical care setting. To support this and other CHW initiatives, Bhnny is also working on standardization of the role of the community health worker. By defining the appropriate training requirements and scope of practice for the regional CHWs, consistency of practice across sectors can more easily advance the improvement of regional health outcomes. Dsrip is asking us to work together in pursuit of the triple aim, not harder but smarter. To do so, we will have to change the way we approach workforce training and utilization, use of information technology and data, communication with our patients, how we address health disparities, integration of services, organizations, and sectors, and how we get paid. By aligning people, processes, and technology across the Bhnny PPS network in an integrated delivery system, we are transforming healthcare delivery in our region in alignment of the goals of the triple aim. If you are involved in a Better Health for Northeast New York Dsrip project, committee, or initiative, you are bound by Better Health for Northeast New York Compliance Program. Noel Hogan is the Chief Compliance Officer at Albany Medical Center and for Better Health for Northeast New York. This portion of the presentation is to provide participating partners and other affected persons and parties with training about the compliance plan and the requirements and expectations necessary to support and benefit from participation in any of Bhnny's programs or activities. All partners, members of their workforce that support the Bhnny projects, board members, and organization executive leadership are required to complete this orientation training. In addition, any providers or other organizations engaged by a partner in an activity that supports a Bhnny project must also complete this training. Organizations that participate in government programs are expected to have implemented an effective compliance program, consistent with the guidance of the Office of the Inspector General and the New York State Office of the Medicaid Inspector General. Providers may be required to have a compliance program already. The compliance program for Bhnny does not replace that requirement, rather supplements it for those additional activities required by our participation in the Dsrip program. If you have questions related to the Bhnny compliance program or about this presentation, please contact Bhnny Chief Compliance Officer Noel Hogan at 518-262-4692. The Bhnny Compliance Program and Code of Conduct is located on the Bhnny website at www.bhnnypps.org. Within these documents, you will find information on expectations for assisting in the resolution of compliance issues, sanctions for failing to report suspected problems, sanctions for participating in non-compliant behavior, sanctions for encouraging, directing, facilitating, or permitting non-compliant behavior, and expectations that compliance-related disciplinary policies are fairly and firmly enforced. To file a report of fraud, waste, or abuse to Better Health in Northeast New York, call the anonymous tip line at 518-262-4369. You and your organization are vital to the success of Dsrip and to improving care in our region. We welcome your questions and ideas and invite you to visit us on the web at www.bhnnypps.org. Because working together, we have the power to create better health for Northeast New York.